Everybody's weighed in on recent changes to Kylie Jenner's appearance. There's a fascination here because this taps into a fear about doing cosmetic work, that we could somehow end up looking off, puffy, or unlike ourselves. So let's peel back the layers of what's happening here, only because the better informed you are about cosmetic work, perhaps altogether we can improve long-term patient outcomes. One thing people are noticing is what's happening here next to the nose. This is called the nasal ala or nasal alar crease. Compared to the relative volume next door in the cheek, Kylie's nasal ala is a bit deeper than what we'd expect for someone at her age 26. Is this simply due to adding volume in the cheeks with filler? No, I don't think so. What may be happening here is Kylie has previously had a rhinoplasty, and when you've had a rhinoplasty in the past, then there can be changes that occur in tissue around the nose later on down the road. For example, the philtrum can lengthen, often leading to a second surgery to shorten this. It's called a surgical lip lift. Kylie's sister Kim had this done following her nose job. Another change we can see after rhinoplasty is called alar rim retraction, and I think this is what's happening with Kylie. The base of the nose retracts, and this can potentially be corrected with a second surgery. Should you go in and just fill the retraction with filler? No, I think you should consult with a facial plastic surgeon. Secondly, it appears that we're seeing some complications of filler placed in the midface or the tear trough. This may have actually been done from a procedure done previously that could have been done months or even years ago, and as the filler is now breaking down, it's grabbing water from the body. It can lead to long-term puffiness or swelling, and this would need to be dissolved with an enzyme that all injectors carry. It's called hyaluronidase, and some PRP in the area could probably help as well. Speaking of PRP, you can not get complications like long-term swelling with the use of PRP or PRF. And the use of this all-natural under-eye treatment is only going to rise in popularity as we see more complications like this with tear trough filler. Not everyone is a tear trough filler candidate, and those who are do not need annual refilling. A concavity under the eye is much more attractive or natural appearing than a convexity or too much fullness. Lastly, this line that we see is a ligament. It's a part of normal anatomy. Everyone has it. The swelling in Kylie's midface is making this line more apparent, and while we certainly don't want to attract more attention to this ligament, we also need to understand that it's never going to go away completely. While I'm not Kylie's injector, complications can happen to any of us. This is an opportunity for learning, and there are practices that can reduce risks. The take-home point I'd make is that filler in the midface can last a very long time. There are ultrasound and MRI studies that show that filler in this area can last for 12 to 14 years. So injectors, please steer away from recommending or performing annual refilling in this area, and stay deep on the bone here in the mid-cheek or the tear trough so that when the filler breaks down, it won't grab water.